The views and opinions in the following program remain those of the producer or sponsor, and not those of Medford Community Cablevision, its staff, management, board of directors, or other affiliates.
Let me sail, let the open overflow. Let me reach, let me beach on the shores of Tripoli. Let me sail, let me crash up on the shore. Let me reach, let me beach far beyond the yellow sea.
Hello, I'm Dr. William Girouard, and welcome to The Doctor Is In. Today I'll be presenting a health topic that I see very often in my practice. It's common, occurs all the time, and I see it frequently during the week. It's a common condition that creates pain, loss of sleep, and a decreased ability to enjoy even the most simple pleasures and simple activities of life, from simple household tasks and performance of a job all the way to sports. Unfortunately, as is common with most of the topics that I talk about, seeking out of medical doctors and medical help is most often unsuccessful, and the condition will continue and in most often cases will get worse. The condition I'm talking about is the neck, shoulder, arm pain syndrome. That's a mouthful, but it's a complaint that has ultimately, in the most simple of cases, and even the most complex cases, a common cause that we'll be getting into. It's a syndrome because it presents many different types of symptoms, many different types of complaints in a person. A person may have 1, 2, 4, or 5 different complaints for this common condition. And how they present themselves in the office, how long the condition has been there, the types of complaints that a person has are all taken into consideration in diagnosing this type of condition. Again, as always, I go to the triangle of health. That's where all of the information I gather on a patient from the case history, from the intake forms, and from talking with the patient, just being a big ear and listening, all the information I sift through consider these 3 areas. And the triangle of health is the physical, the chemical, nutritional, and the mind, emotions. The chemical nutritional are the things that we eat, things that we drink, medications we take or don't take, vitamin supplements we take or don't take, just an overall lifestyle, the air that we breathe, the overall lifestyle that considers what we take into our body on a nutritional and a chemical level. The mind emotions, our attitudes, our beliefs, whether we have a optimistic or pessimistic attitude, whether we have a melancholy or a happy attitude, those are all considerations in your health. And most important today, which is really the key area that we need to talk about, is the physical. The physical is, in my case, the consideration of the structure of the human body, and most especially the spine. As a chiropractor, we deal with the spinal health and the nerves that come from the spine. And as I'll show you when we get to the more detail about this pain syndrome, the consideration of the physical is of paramount importance when looking for the cause and looking for ultimately the treatment and resolution of this type of problem. The predominance of the physical symptoms and physical findings most often explain and detail where the true cause is of this syndrome. The chemical nutritional has an effect on it, but it's not generally very significant. And the mind emotions has a cause and effect, obviously, but not generally in a very a significant way. The mind emotions can be affected by the pain and the debility that's caused by this kind of condition, and that it needs to be looked at. A person who comes in feeling melancholy, depressed, sad, nervous, anxious, hair trigger emotions, volatile, it could be because, not because their mind emotion is generally that way, but because they're in a lot of pain. And a lot of pain over a long period of time will create and really grate our mind, grate on our emotions. We've all been in pain for a considerable amount of time, or even a short amount of time. And the degree of pain will cause a significant change in our attitudes and emotions. We get snappy, we get cranky, we can't sleep, we get sleep deprived. So pain most often has the effect on the mind emotions as opposed to mind emotions having an effect on the pain. We cannot imagine, we cannot create pain. It's just not doable. A lot of people are diagnosed as having a condition that's quote unquote in the mind. But pain cannot be imagined, it cannot be thought up. The consequences of pain can be magnified depending on the person's ability to tolerate pain, but the pain condition itself cannot be imagined and cannot be created by our mind. Either it's there or it's not there. The degree that it's there cannot be downplayed simply because the findings don't fit into a medical model or don't fit into a model that's easily looked at and easily considered. The thing about the shoulder, neck, arm pain syndrome is that the physical causes are looked at from a chiropractic point of view, which gets, again, back to the spine. When the spine is involved in conditions, going to a medical doctor will not bring out a successful outcome. Medical doctors have expertise in certain areas, and they're very good at what they do. But it does not include the looking at the structure of the human body affecting our health and affecting pain conditions. And that's exactly what this type of situation presents itself with. The vast majority of this type of condition is musculoskeletal oriented, spine oriented, muscle oriented, structure of the body oriented. We're not considering and we're not looking at tumors of the spinal cord, tumors of the brain, malignancies. We're not looking at that area. Those are, from my point of view, rare because I don't see them. The medical establishment is equipped to deal with those types of pathological issues, and that's what they're good at. And that's where those types of patients who have an involvement at that level and to that degree of pathology need to go to get evaluated and treated. But that's not what I'm talking about. What I'm talking about are the 95% or even higher of the people walking around with neck, shoulder, arm pain that is not caused by a tumor, not caused by a spinal cord injury, traumatic, that needs medical attention, not caused by a malignancy or a spread of a cancer or something like that, not caused by a pathology. The vast majority of people experiencing this type of condition, the cause is structural, spinal, muscular system oriented. And that's what we're talking about today. So it's important you consider that. I don't want to see those other people in the office because I'm not equipped to do it. That's a medical profession. That's what they're good at. But what I'm talking about, I call them the walking wounded. And you know who you are out there. You're walking around with this type of pain syndrome that I just described, and it's interfering with your life, interfering with enjoyment of your life, performance of your job, sleep, enjoying your children, enjoying the sports you might like to play. It's limiting you in a significant way depending on the involvement and depending on the degree of involvement of the injury or the pain condition. So these are the conditions that I'm talking about. And by and large, the vast majority of those types of conditions that I see in my office are not complex to fix and not complex to remedy and to get a person alleviated of their pain back to a stable condition so they don't have to worry about the pain coming back. And if it does come back, it's easily addressed with the treatment that I, as a chiropractor or any competent chiropractor, can perform. So that category of patient, that category of person is what I'm talking about. And there are thousands and thousands and thousands of you out there. And you're the people I'm talking to. So listen to what I have to say, evaluate it, see that it makes sense, and it does make perfect sense, and then consider seeking out the real treatment, the real fix to it. The mind, emotions, chemical, nutritional, physical. So let's deal with the physical, because that's, again, the vast majority of the type of problems, the origin of the of the cause of these types of problems. Okay. First off, what is this type of condition? Well, it's pretty self-explanatory. It's neck pain, specifically neck pain, shoulder dysfunction, can't perform the shoulder exercises, can't move the shoulder, it's weak, it's irritated on movement. The one side of the body, left or right shoulder, is more involved than the other, and it can also radiate down into the arm and hand. Carpal tunnel, as an example. Is an example of this type of pain condition. Typically, carpal tunnel is pain in the hand, tingling, numbness in different parts of the fingers, in different parts of the hand. And there is a syndrome where the carpal tunnel, the nerves that pass under the soft tissue and the ligaments and tendons of the hand, can get compressed, and it can create dysfunction in the hand and cause a tingling sensation. However, that's not necessarily the only cause of it. The cause can come from pinched nerves in the neck. It can cause from a pinched nerve in the elbow. It can cause from a shoulder that's the muscles are tight and irritating the nerve, which causes a radiating pain down into the hand. And it has nothing to do with the carpal tunnel area, the wrist area. So there's an example of an arm and hand type of pain that sounds like it's only oriented to the hand, but it's not. It's oriented to the spine and to the structure of the spine, which again is what chiropractors deal with. Okay. What are some of the symptoms? Again, simple one is pain. Pain is the vast majority of the reason why people come to my office. Pain is a great motivator. It can be pain from a scale of 1 to 10. It can be mild, 1, 2, or 3, or it can be severe, up to a 10. Where the pain is so debilitating that prescription medication and all kinds of pain clinics are consulted in order to get rid of the pain. That's the first symptom, loss of function. And what do I mean by that? It means the arm, the hand, the neck, turning of the head doesn't work correctly, doesn't work well. There's a restriction of neck movement because of pain. Turning to the right or left causes that crick in the neck. There's an acute sharp pain that's always there, restricting motion. That's loss of function. The arm and the hand can become weak. The nerves that go to the arms, muscles can be impinged, and if they're pinched, then the muscles can't possibly work well to 100%. It's working 80, 70, 90%, but there is a loss of function, which means the person has difficulty doing a sport, has difficulty writing, there's cramping, has a less ability to lift things, lifting barrels, lifting the trash. There's one side that's weaker than the other, trying to reach up into cupboards. One side can't reach as high as the other side because there's pain and the strength isn't there. Opening doorknobs, lifting jugs of juice or milk. There's a weakness in the arm and hand. Opening car doors, not so much flipping, but twisting of car. They don't have twisting of car doors, but trying to open things with the arm and hand. If there's a weakness there, there'll be a distinct inability, a loss of function for that to happen, to the way it's supposed to. There can be sensory. Okay, this is motor. Motor means muscle. Inability of the muscle to perform at 100%. Sensory, that's the tingling, numbness, the pins and needles, Those are all the sensations that are found in most oftentimes in the hand. The shoulder areas can have patches of numbness. A person can just sense that there's just no feeling there. The head and neck area can radiate into the face area where there's areas of numbness, areas of tingling. It can give headaches. The neck, shoulder, arm syndrome itself can create headaches because of the irritation to the nerve roots in the neck. So that's a sensory issue. I'll put that down because that's important. I could build a practice on headaches. Headaches generally are not difficult to treat. I'm not talking about the migraine headaches that puts a person in a dark room with a cold cloth over the face. Although they do respond to treatment, it just takes a little bit longer. But the more uncomplicated, all the way from the occasional headache up to the migraine headache, are caused by this type of syndrome. And the reason why is it's a nerve root irritation issue and not a deficiency of aspirin or ibuprofen. So headaches, I could build a practice on it for people. If everyone who'd come in who takes aspirin, who takes ibuprofen, who suffers with headaches once, twice daily, has headaches, consider going to a chiropractor to get alleviated, because I'll show you the causes of it, and that's right up to what chiropractors do and what we're experts in, treating the true cause of the vast majority of headaches. So all these sensory issues come into play when we're talking about this syndrome, motor, muscle, and obviously specifically pain. And this can range on a scale of 1 to 10. 1 to 10 is mild, all the way up to severe. It can be acute, all the way up to chronic. Acute means days, chronic means years. Okay. That's a pretty wide range we're talking about. And the reason why, even though this range is huge and takes in all the majority of the syndromes that I'm talking about, conditions and people who come in to me, the reason why, even with this huge range, the reason why it's so treatable is because there's a common cause to all these types of syndrome conditions and symptoms and complaints. And the common cause, once it's treated by chiropractors, the symptoms and the complaints go away, and the person can be relieved of their suffering and debilitation. So don't think that just because it's bad and severe that, oh, that's not a chiropractic concern. It's not true. The more severe condition, the more there is to fix, and the more response and the more positive response a person will have. I've seen patients with this type of condition, they've had it for decades and decades and decades, and they've sought medical treatment for it. They've gone to acupuncturists, massage therapists, they've tried nutrition, they've tried vitamins, they've tried exercise, physical therapy. All these things have been tried by the people I've seen with no results. There are some people who get results because, and I won't see them because they fix themselves with therapy or with exercising, with sports. And for all of those people who are fixing themselves, that's great. That's because the spinal nerve involvement of those people was not that significant a problem. It was a syndrome that was, in their case, was caused by lack of muscle tone, a bad diet, acupuncture points and meridians that were out of balance. And again, those aren't the people I'm talking about. For all the people that do get results from all those other therapies, that's great for them, but that leaves a huge percentage of the people, and in some cases I think it's a majority of the cases of people who do not get results or who get partial results. They'll get a 50% alleviation of their pain or debilitation. They'll get a partial relief of what they're going through. And that's because the missing element is the spinal nerve root irritation and muscle involvement that needs to be considered. There is no one cause to all the pain conditions that I talk about in any of the shows that I've given. There's no one cause to it. There oftentimes are multiple causes, and there are oftentimes one cause that has nothing to do with chiropractic. So don't think that I'm up here saying chiropractic is the fix-all for everything, because it's not. But in the majority of cases, it needs to be considered for therapy for conditions that have not responded, that keep coming back, or that have responded only partially. That's when you consider looking to chiropractic along with other therapies for the alleviation of the syndromes that I'm talking about. So chiropractic is not an answer-all to everyone's problem. It doesn't exist, and just as the medical profession doesn't have the answer to everything, neither do chiropractors. But we have an expertise in a certain area. For the thousands and across the country, the millions of people who are having this condition do respond to chiropractic care, because that is a significant percentage of the cause of the reason why they're having the condition. So you have all these symptoms, and you know who you are if you're having these symptoms. You might have even tried some of the therapies I talked about: acupuncture, diet, exercise, physical therapy, medical intervention with medications and muscle relaxants, and time, give it time, and will a lot of times these things won't work, or they'll work partially. And you know who you are out there. You're sitting there still suffering with the symptoms that I'm presenting to you, and still having the conditions, even though you've tried so many things. And frustration can start to set in. Well, if you've not tried chiropractic care, now you can put this in your toolbox of another therapy to use and to consider for the complete resolution of the problem that you're having. And for those of you who are having the condition who have not sought any care, start with a chiropractor. The reason why is because chiropractic and spinal nerve involvement is the most common complaint that creates this type of syndrome on a percentage basis. In other words, for someone who's suffering with these symptoms, chiropractic care is most often the reason why, and the reasons chiropractic spinal care is most often the cause of the fixing of that type of problem. And the spine and the irritation of the nerve roots in the spine, the classic pinched nerve, that's most often the cause of this type of condition. Okay, so looking at this, now we have an idea of what type of pain and symptoms a person can have. Now, I've been talking about what's the real cause of it, what gets back to the cause of this type of condition. Well, aside from the fact that it could be a medical problem, we're dealing with something that's chiropractic, and we deal with chiropractic, we deal with the spine. When we deal with the spine, we're talking about the nerves that come out of the spine. Okay, we have spinal segments. This is what you look like from the back, the spine. These are the vertebrae. Okay, and these are the discs. You've heard about the discs, disc problems. Okay. And out of the spine is here, and you have the brain here. B-R-A-I-N. And the brain's up here, and you have the spinal cord coming down here, And the spinal cord sends out branches to all different parts of the body. Now, if this is the neck, now we're talking about neck pain, arm and shoulder pain. Okay. And the hand. And the arm. So as these nerves come out of the spine, what happens? They come out through little holes in the spine, little openings that enables them to go to different parts of the body. What happens is these spinal segments are flexible. They're flexible, they move, they have motion attached to them. That's why we can move our body and twist and turn and do all kinds of contortions with our body. It's because of the tremendous flexibility within the spine. And attached to the spine, obviously, are muscles. And these muscles that are attached to the spine contract a muscle on one side, the head goes one way, it goes another, turns, rotates. Arm goes up, arm goes down, arm goes out to the side, goes in front. Everything's controlled by the muscle and the nervous system. What happens is when these spinal segments are perfectly aligned in relation to one another, then there is no nerve root irritation. And if there's no nerve root irritation, you have 100% nerve function. If you have 100% nerve function, you don't have this. Or you could have it, but there's another cause to it. So from a spinal nerve, in a chiropractic point of view, if it's 100% nerve function, then you've got to look to some other area for the cause of the symptoms and complaints that you have. A lot of times, however, the nerves are not functioning 100%. They're functioning at something less than 100%. Let's say 80%. Because as these nerves pass out of the spine, these vertebrae can rotate and become misaligned. When these become misaligned, they can irritate and pinch off the nerve. Imagine a garden hose. You have water coming out of the hose and you want to water the garden. But if you step on the hose and you compress the hose, you pinch the hose, and you restrict the amount of water coming out the other end of the hose. So instead of having 100% of the water coming out of the hose, now you have, by stepping on the hose, you have 80% of the water. So 80% of the water is going to come out of the hose. And the garden will get 80% of the water that it needs. Same thing with the spine. If you irritate a nerve as it comes out of the spine and decrease the nerve impulses along those nerves to 80%, wherever that nerve goes will function at 80%. Common sense. It's like a rheostat in a light. As another example, you decrease the amount of electricity, the light dims. You decrease the amount of nerve flow to a muscle in the shoulder, let's say, the shoulder will function at 80%. Well, what does 80% function mean? It can mean two things. It can mean pain because you have muscle spasm, muscle contraction, and you have a pinched nerve, which hurts. Imagine catching your finger in a door, how much that hurts. Well, imagine compressing a bare nerve or having a root canal. You touch a nerve and a root canal, you go through the roof. So a nerve is very sensitive, so it can create the pain that we talked about. It can create the loss of function. If the muscles of the shoulder or arm or the hand are only functioning at 80%, what kind of symptoms are you going to have? You're going to have loss of strength, inability to lift containers of water or juice or milk, inability to do a sport equally on both sides, inability to lift the household things that need to be lifted, bags, trash, whatever you have. You can have a loss of function in that arm. It especially manifests and shows itself when a person is involved in a sport, if they're lifting weights. One side is weaker than another. A lot of times our body can compensate. We don't notice that it's only at 80% because we're so used to it, we don't realize it. But for someone who is aware and does notice a difference in strength one side to the other, it could very well be due to a pinched nerve. 80%, well, let's say it's 20%, which happens over a period of time. It could be 80% after a month, decrease nerve flow through that nerve. Over a period of 5 years, 10 years, 20 years, it can get down to 20%. What does 20% of a nerve flow mean? It means atrophy of a muscle, significant loss of function, significant loss of ability to move the arm, hand. It could create a carpal tunnel type effect, create all kinds of pain, motor, and sensory problems. The tingling, the numbness, all those can be manifest themselves into a more of a severe degree. So that's the scale, 1 to 10. 80% maybe a 1 or 2 or a 3. 20% function, maybe all up to a 10, to where the pain is severe, loss of function is severe. So you have all kinds of gradations, all from simple pinched nerve in the spine. So you have the neck, shoulder, and arm pain syndrome caused by an important factor that's not considered when a person goes to other alternative treatments, acupuncture, massage therapy, prescription medications or over-the-counter pain medications, physical therapy. Those are great for their areas that they treat, but they have no effect on the spinal nerve root irritation that's happening. And if there's no effect on the spinal nerve root irritation, then the complete resolution of these symptoms will not happen. Simply, it's common sense. So depending on a person's involvement and the degree of nerve flow blockage that's there will give the amount of pain syndrome that they're having, the amount of symptoms that they're having. Okay, so pinched nerve is one cause of these kinds of complaints. Okay. The second is a muscle involvement. Okay. There's one, and two is muscle. Let me get reattached here. Okay. The muscle that gets involved can be from the pinched nerve, the muscle pathology, the muscle dysfunction, the muscle weakness, the muscle pain can be caused from a pinched nerve. So alleviate the pinched nerve, go to a chiropractor, get the spine adjusted, get the pinched nerve alleviated. Now, what happens to the muscle? The muscles are now getting 100% innervation from their spine. However, there's a funny thing that happens in the body that needs to be explained as to why the dysfunction, why the symptoms may not completely be alleviated simply by a chiropractic adjustment, simply by alleviating and lessening and getting rid of the pinched nerve. Consider the appliances you have in your home and the circuit breakers down in the basement. You plug in a bunch of things and you overload the circuits and the circuit breaker trips. Now half the house or a room to the house doesn't have the electricity it needs. Okay, now the cause of it was an overloading of the circuit where you plug in all the appliances or whatever's being plugged into the wall. That's the pinched nerve. So you take away, unplug everything from the wall or the circuit, decrease the load that's being drawn, and that's equivalent to alleviating the pinched nerve in the spine. However, remember the circuit breaker in the basement has been tripped. And that's the equivalent of a muscle over a long period of time or short period of time having the symptom of muscle pain, muscle weakness, soft tissue pathology, soft tissue cause of a problem that we're evaluating now. The muscles have their own ability to create pain and create dysfunction. And simply by going to the nerve and alleviating the pinched nerve, like the circuit breaker that needs to be manually flipped for the electricity to come back on, so too do the muscles need to be physically worked on because of the physiology, the way the muscles are structured and the way the muscle fibers are. So too must the muscles be worked on, just as a circuit breaker was flipped to turn the electricity on, in order to get rid of the remaining symptoms of this syndrome. It's important you understand this concept because many of the patients I see in my office have irritation to the nerve roots, yes, and they have pain syndromes wherever it might be. And as a chiropractor, I evaluate, treat the spine, get rid of the pinched nerves, eliminate them by adjusting the spine. However, they're still having the pain in the area that they're showing up for. They still have the shoulder pain, the hip pain, the leg pain, whatever the pain is, that's separate from the spine. And the reason why they're still having it is because the muscles themselves, the soft tissue, the ligaments, those parts of the body have their own ability to create pain and dysfunction on their own. That had nothing to do with the spine, had nothing to do with nerve root irritation. And if a person who has this area involved is not treated in this area of the soft tissue and muscles, then they're going to leave feeling a little better, but they're going to come back with the same pain syndrome, or they're going to have a 50% or a 60% success rate, and they'll still be having the pain, the dysfunction, the problem in the area that they came in for treatment. Because by not addressing the muscle and the soft tissue component of the pain that's causing the pain, then missing out on a big reason why the pain is there. And the pain comes back, or the pain never really goes away. So the muscles, the soft tissue, need to be evaluated and looked at as their own cause of the syndrome that a person has. So right there, I'm away from the chiropractic model. So even as a chiropractor, I can realize that chiropractic doesn't answer all the questions. It doesn't resolve all the issues that's contributing to a pain condition, or to a sensory condition, or to the headaches. And only when the muscles and soft tissue are looked at and evaluated can these areas be fully resolved. Now, why do the muscles become involved? Why is this so important an issue? It's because of the way the muscles are built, the physiology of the muscles. Okay, muscles, you have muscle fibers. We all know what muscle fibers are. Muscle fibers are like strands of hair. They're all fibers, and they interlock, and when they run smoothly, then there's no pain, no dysfunction, and there's 100% performance of that muscle's activity. However, when there's trauma to the muscle, when there's a pinched nerve in the neck or the upper back that's lessening the amount of nerve intervention to the muscle, or there's overuse of the muscle, or whatever the multiple causes are, these fibers can become intertwined and entangled and become like steel wool. Have you ever seen steel wool? All steel wool is individual strands of metal that are just mushed all together, and they're all twisted and tied into each other. That's what a ball of steel wool is. If you took the time, you can take out each individual strand, and all you'd have would be hundreds and hundreds of strands of steel. But when they become intertwined, they have a function. They scrape, and they can do their job. But just like the muscle fiber, the steel wool fibers can become intertwined, or hair can be messed up, needs to be combed, so too can the muscle fibers be physically intertwined and physically interconnected to where there's dysfunction of pain and loss of function. And that analogy with steel wool is very important. That's why a person who maybe goes to a massage therapist or gets rolfed or does some kind of minor stretching gets a relief from this condition that they're having, or they feel good or it feels great. But what happens? It comes back in a day or two. The reason why is because, one, the pinched nerve wasn't resolved, which creates the intertwining and interconnection of these fibers again, even though they've been massaged out, and all you do is get a return of these fibers. Or two, they weren't done hard enough or consistently enough or long enough, which I find oftentimes is a reason. So you have a common intertwining of all these muscle fibers, and that gives pain and dysfunction. What you want to have happen are the fibers perfectly lined up. Remember the steel wool, taking out each individual metal thread? When you have muscle, this is 100% of no pain, and no dysfunction, no loss of function. And this is essentially going back and setting the circuit breaker. Here you have your circuit breaker all mushed up, and this causes pain and loss of function. But here you have fibers that are nice and lined up, and there's no pain and no dysfunction. And this is really a healthy muscle. This is a muscle that's been involved with trauma or has had a pinched nerve creating the issue. So you can see now that alleviating the pinched nerve at the spinal level will not fix this, because the circuit breaker needs to be reset. These muscle fibers need to be realigned. And if these misaligned muscle fibers are not done, then a person can continue to experience a partial relief of their symptoms or no relief at all. Or it may take more than one treatment or many, many more treatments in order to get the situation resolved. So here's where addressing the actual structure of the muscle, structure of the soft tissue is important. And that's what I do in my office. I look at a person from a spinal nerve point of view, but I also treat the area of the condition that they're having, be it knee. Today we're talking about the neck and shoulder and arm. And I look at the muscles and check out the muscles and do muscle work in order to straighten out and smooth out these muscles that are all intertwined like the steel wool. That gives a more complete and a quicker resolution to a problem. If a person, the problem is that not all chiropractors and not all believe that that's necessary. I am of the opinion, and I've been doing this for a long time, that to not do this would be not giving the person a chance to get better quicker and get better more completely. The results I get in my office for a lot of musculoskeletal pain conditions, and more especially sports injuries, and our reason why I get such good results is because I do look at the muscle and soft tissue part of the component of the cause of the problem. And by addressing it and getting a muscle back to as smooth a condition by manually working on them with the hand, doing trigger point therapy, and doing it very aggressively, then the person's condition and syndrome can be resolved much more quickly, much more completely. There's more of a chance that there'll be 100% resolution of the problem as opposed to a partial one. And experience and doing this over the time that I've been in practice has proven to me that I need to address the muscle soft tissue component of a problem in order to completely treat a person. It takes a little extra work, it takes a little bit more education, to lead up to know what to do and how to do it. You can't just get in a muscle and rub on it and expect to get results. There's a lot that goes behind it as to where on the muscle and the anatomy of it and the physiology of the muscle and where and why this pain syndromes are happening. Making connections that the pain syndrome may be happening because of some problem in another part of the body. So all this is what experience has taught me over the years. And by addressing these two areas, there's more of a chance that, and there's more of a resolution of the presenting problem. So when I say that these are the common causes of the neck, shoulder, arm pain syndrome, that's what I'm talking about. And all the exercise in the world, all the acupuncture in the world, all the rest and ice and cold packs, doing all of those things will not have an effective outcome in the people who have pinched nerves and who have significant muscle involvement. It may work for some people, and that's good, but we're not talking about the people that those other therapies have worked for. Again, I'm talking about the people with these types of involvement. And this is the majority of the people who have involvement. Even those of you who have gotten results from other alternative therapies and got resolution or a diminished amount of pain and return to function, within that, there's still a percentage of you who still need to have the muscles worked on and have your spine evaluated because you haven't gotten to 100% or as close to 100% of resolving of the problem that you would have if you got these things checked out. So even though you've gotten some relief and exercise has helped and yes, you need to stretch out and need to do all these things, even if that's an ongoing thing that needs to be done, pay attention to the fact that you might still be hurting. You might still be having dysfunction. You might still be having some sensory involvement. That's where, and if you still are having that, being honest with yourself, then you need to consider that maybe some part of your recovery is being slowed or impeded by the fact that you have pinched nerves in the spine and muscles that are not completely healthy in the way that I talked about over here. So when you think that you've gotten all the relief that you can, there's a good chance you haven't, and you need to evaluate and check out that for yourself. What are some of the other symptoms that can happen? I talked about headaches. Now, what is headaches? Obviously, headache doesn't have any muscle involvement that is obvious to you, but headaches can have a muscle involvement in a way that you really don't expect. I'll get a little off track here, and I'll talk specifically about headaches, just to show you that this syndrome can still be affected, can still affect those of you who have headaches and be a fix for the headaches that you're having. Now, when I talk about muscles of a headache, some of you who have headaches, I'm talking about muscles of the arteries and muscles of the circulatory system. Okay. Arteries go and bring blood to the brain. Okay. The brain itself, by the way, does not have any nerve endings. You can take a probe and poke around in the brain and you wouldn't feel anything because the brain itself, the brain tissue, doesn't have innervation of a sensory type. So there'd be no pain. So what's a headache? A headache's not a brain problem. A headache is an arterial blood flow problem. Arteries have muscular walls. In other words, an artery is a tube of muscle. And the tube of muscle has innervation. Remember I talked about everything, every muscle of the body has innervation from the spine, ultimately. So you have muscle walls, which are arteries, with nerves going to them. Well, what do muscles do? They contract or they expand. When there's less innervation, less nerve flow going to them. Less nerve flow, a muscle will expand or contract less. More nerve flow, a muscle will contract and more. So you have a nerve going to the arteries of the brain, and the brain has tremendous amount of blood and blood need, so there's a lot of arteries going to the brain. And there was all this whole circulatory system in the brain, all made up of arteries. And arteries have innervation. If there's innervation, there's a sensory component to that innervation. There's a motor, which is muscle, which causes the artery to contract or less innervation expand, but there's also a sensory component to that nerve. And those nerves send sensory information back to the spine and ultimately back to the sensory system, and we perceive pain. Now, what happens when a muscle wall of an artery that has innervation to it constricts too much? You have a vasoconstriction headache. And the arteries, because they're constricted so much, send out sensory impulses that creates pain. Or it can be a blood flow where there's a dilation. And the arteries dilate, and in dilating, it sends out a sensory impulse to the brain that says pain. So there's a delicate balance. Too much constriction can cause pain, too much dilation can cause pain. Constriction that's quick, or the dilation that's too quick, can also create sensory pain. So there's a fine balance that's going on. And when there is a balance, there's no pain, no sensory input to the brain that says, I have pain. So that balance needs to be maintained. And that balance is maintained when there's most closely 100% nerve flow to the arteries of the brain. Now, if there's 100% nerve flow or close to it, then there won't be any dysfunction, there won't be any imbalance that creates the headache. But what if the nerve flow to the arteries of the brain is significant enough that it creates those sensory inputs into the brain that causes pain? Well, you're going to get a headache. And what's a headache is strictly an arterial problem. Too much constriction or too little, which is dilation. And it all can happen from the pinched nerve in the neck and in the upper part of the back, that all ultimately go to the brain. So it's a circulatory issue. Brain headache causation is the majority of cases a circulatory issue, and that circulatory issue is created and caused by pinched nerves in the neck. Ultimately, yes, it is a muscle issue. So the muscles of the arteries, obviously you can't get in there and massage them and work on them, but it's not necessary because they don't have that structure that they need to have that happen. They're different than skeletal muscle. So you have pinched nerves going to the arteries of the brain, and if it's 100%, nice, perfect balance, then you have no headache, or you have resolution of the headache. And that can be anywhere from a migraine all the way down to a simple common stress type of headache. Migraines are a different animal in many respects because they can have triggers. The arterial dilation or arterial constriction can have many triggers. The spinal nerve root irritation in the pinched nerve is only one trigger. Another trigger is a toxic metabolite in the body caused by a food. There are certain foods that a person is sensitive to, and they can create biochemical and metabolic changes in the body that creates arterial spasm or arterial constriction because a person is sensitive to them, and that will create the headache. Migraine sufferers often have triggers, and certain triggers are more common than others because they're toxic to the body. And in being toxic to the body, one of the consequences of them can be a headache. It can also be a lightheadedness, and can be a number of things. But here we're talking about headaches. So when we're talking about arteries and muscles, even though directly it's not a pinched nerve issue, it can be caused by a food or a drink, some liquid that a person is drinking that serves as a trigger to upset this delicate balance in the arteries of the brain that give the headache. And for migraine sufferers and for other people who have sensory types of problems, which is what a headache is, then looking at what you eat and what you drink as a trigger can oftentimes be a very successful thing to alleviating the ultimate cause of a headache, even when the nerve system is functioning at 100%. And this is more dealing with the migraine sufferer, people who have very debilitating headaches. Some medications, prescription medications and non-prescription medications, food colorings and dyes, all ultimately create an imbalance in the body that leads to a toxic situation that can create an imbalance that creates the headache. So I've talked to you about the neck, arm, shoulder pain syndrome today. I'm sure a lot of you can relate to what I've been talking about. Hopefully I've given to you the common cause of this type of syndrome, and know that you don't have to deal with it. You don't have to live with it. Just keep an open mind. Check with a chiropractor who you have confidence in or can get to, and see if the condition that you have is not one that can be more effectively treated with chiropractic care. Thank you for tuning in today, and I'll see you next time.
Let me sail, let the Orinoco flow. Let me beach on the shores of Tripoli. Let me sail, let me crash upon the shore. Let me beach far beyond the yellow sea.